Hello, I'm Dr. Deepak Rao, consultant laparoscopic surgeon at the Motherhood Group of Hospitals, Bangalore. Fibroids are benign tumors of the uterus, usually benign tumors of the uterus. They are tumors of the wall of the uterus, the muscle of the uterus, unlike tumors of the lining of the uterus. Tumors of the lining of the uterus can be benign or malignant, and they are either polyps or uterine cancer. Tumors of the wall of the uterus are either again benign largely, or it could be malignant. If they're benign, they're called fibroids, and if they're malignant, they're called sarcomas. Next, what are the symptoms of fibroids? Patients with fibroids have a number of symptoms. Can have a number of symptoms. Some of them are asymptomatic and they have no symptoms, but a large number of them come with pain, bleeding, abnormal periods, frequent periods, heavy periods, pressure on the bladder, pressure on the rectum, infertility, which is a very common symptom of fibroids, and sometimes recurrent miscarriages or pregnancy losses. So what are the surgeries that we can do for fibroids? There are two types of surgeries. One surgery is just a removal of the fibroid itself. This is called a myomectomy. And the second surgery is removal of the uterus itself with all the fibroids, and this is called a hysterectomy. The merits and demerits of each we will discuss at a later date. Who needs the surgery? First of all, if any patient has symptoms which are bothering her, she needs the surgery. What type of surgery again will be decided on her age, whether she wants to have children or not, and what the symptoms are. Patients who don't have symptoms also need surgery if 1. The fibroid is larger than 4 to 5 centimeters, 2. If the fibroid is rapidly growing, 3. If there is a suspicion of malignancy in the fibroid, and 4. If the fibroid is putting pressure symptoms on the ureters, which are the tubes that carry urine from the kidney to the bladder and thereby causing damage to the kidneys. So what are the complications of fibroids? The number one problem with fibroids is that they can grow and grow and grow. They grow fairly large, and we have removed fibroids sometimes which are as large as a 9-month pregnancy. So this is the biggest complication. If you wait too long for the fibroid surgery to be done, the fibroids can grow big enough to make the surgery long and complicated. The second complication is bleeding. A lot of these patients have heavy bleeding. They'll end up with anemia and further complications of the bleeding itself. Then of course infertility, recurrent pregnancy losses, miscarriages are all problems that fibroids can cause. And last but not the least is the rare chance of a fibroid having a malignancy. The risk of that is probably about 1 in 1,200, but it is a significant risk and it needs to be taken into consideration. Thank you.